here doing an amazing case, male facial sculpting and tightening. He already looks really good, but he's a leaner guy, and I'm injecting right now temple because I want you to see areas like his chin and jawline. As we age, we lose volume, you lose a little bit of that, you get recession, you get lower volume. It looks good, but once we contour these masculine areas like the cheek, chin, jaw, and we fill out temple, he's gonna look a lot more youthful. Look over here, you can see, you know, as guys get lean, especially nowadays with like GLPs and people really working out a lot, running marathons now. Look at the leanness, you can see the bone structure here, and we don't want him as he gets older to have, you know, loss of contouring and for him to look more skeletonized. So this is gonna help us really build the structure for him and just imbalance. So like, for example, we're doing this temple area and already you can see it's a lot more balanced. Now initially it's gonna look a little swollen, but then it'll blend in. So look at the difference between here and here already in just one scrimmage. So this is one of the areas where, you know, I don't think people talk about nearly as much, but I just did a consultation right before this on a virtual for a patient of mine, or for a new patient of mine that, you know, had done filler elsewhere for male facial sculpting and only did a syringe to his cheek and chin. And they didn't even address jawline, temple, lip, and his mid-face because he lost so much weight. So he was very appreciative of us being comprehensive and him wanting to look his best because he's getting married, right? So why not address all the patient's needs properly by addressing all the anatomy? And for him, we want to address all those areas. So first we're gonna work on the foundation. This is what I call anatomical filling. So we are filling based on structure right now, okay? And even so, you could even come up through here and do brow and fill this area here in the fusion line to give more if we wanted to, but we're starting out easy, not going too aggressive.
So I want to know, is there a most common area that doctors forget to do when they do male facial sculpting?
Yeah, the lips, the chin crease, lips, temple. Lift your head just a little bit. There you go. So I want to show you guys something. You see how right here, there's this little pucker. That's because he has lower volume here. So we're going to do a couple things. We're going to first give some structure on the cheekbone. Very little. And we do this right on bone, small amount. It's going to look a little more swollen today, but it will totally settle in and be fine. It can be very little. These are very 0.05 aliquots. Tiny, tiny, tiny. And if you want to learn about this, we do this at Emer University, okay? And so that will give him some horizontal structuring. I'm gonna do a little bit more here. Just a teeny bit. Okay, perfect, hold right there. And then we're gonna go to the other side, do the same thing, but I'm gonna do a technique that's gonna blend this now, right after. I'll show you guys. All right, so same thing again, higher cheekbone, drop in the mid submalar triangle. So we're going to just do that a little bit of horizontal, very small amount. He's doing excellent, I'm so happy. Okay, so again with him, you can come out a little bit more laterally, but it's not laterally and superior. It's laterally horizontal. And that is different. It's hard for people to get because these companies train you on these like lines that you draw on people's faces, trying to give them a templated look. And guys' faces cannot be templated. So now we're going to I'm going to leave the submalar triangle for a second. And we're going to do his chin. Now you guys see here, there's a lot of recession right here. So my goal initially is, let's build out the chin structure, okay? I know it doesn't feel good, but it looks good when it's done, so it's worth it. Chin always makes or breaks everyone. Same for lip. And we're going to build that out. Now, good. You guys can see, take a look already with that little bit, just that half a syringe does not only to the face but also the neck, because by projecting the chin, the neck comes up and the pre-jowl improves. So you just look younger overall. Going to the other side.
And someone has a question about Botox. They say, can you get immune after years of Botox?
Yes, oh my God, you guys. Right now, there's this thing going on TikTok about people using MyoBlock, which is not approved for the use of cosmetic purposes of a toxin. People saying, oh, that's what treats Botox immunogenicity, but that's not necessarily true. It's a different type of toxin. This way, toxin type B. So, all right. Again, right on the bone, creating that structure. But again, we need to do this area, okay? And other people say, don't inject lines. That's not, we're not injecting lines. We're creating foundation, okay? Foundation. Let me show you. Okay. So, we're going to take we're going to take the radius, we're going to hyper-dilute it. So this is a diluted version. We're going to go through here because he has so much perfect good that we really need to, guys tend to bleed a little bit more because they have hair. Okay, and we're going to use that diluted radius to build that structure, okay, on the more in that crease. You see what it's doing here. I'll show you guys in a second. Perfect, okay? Starts right there. Okay, coming back. Now we're gonna go a little bit wider, turn it this way to here, and create that line, okay? So guys wanna see, I like the tight look. Okay, so again, we're going to create a little bit more of that structure, build that out. Okay, there we go. Okay, perfect. Beautiful.
Someone says that they use CAHA diluted, but scared to do it without because you cannot dissolve if there's a vascular occlusion.
Well, I mean, look, everything that you inject, no matter what, is almost impossible to dissolve when there's a vascular occlusion anyways, unless it's HA direct, that's soft, and you have an ultrasound. But here's the thing, everybody that's injected a lot of filler before has complications, and I've had a couple occlusions for whatever reasons, I think more just drank bad luck. Everyone has healed perfectly without any issue. So, again, when Radius is used properly, I've been using it since 2006. I've had never once issue ever. And my fiance, everyone I know has it. Okay? I do it all day, every day. Multiple syringes. So I don't think it's material. I think it's the injection technique. Okay, again, working on that crease. Because look at now. Now you guys can see, hold on, I'll show you a little bit more. This is the key. Let me show you. That structure now. Look at that. Look at the angle. Hold on 1 second. Hold that needle there. So, a little bit more. Okay, again, hyper-dilute. Using that. Look at that nice height. Perfect. Okay, we're going to come back. We want to leave it in there. Here, all right, one more pinch, here we go. Perfect. We're going to create more of that structure now. Okay, there we go. Perfect. Again, evening out this width. Let me see. Hold on. Perfect. So now if you see all the way across, you can tell the difference between here and here, right? Because we have some less volume through there. but we needed to create that structure. So a little bit on the mid-face, right in the piriform, to give some lift. If you wanted to, you can take that and go right above to the deep medial fat pad right here. Hold on. Just a little bit of volume right above. Fold, and that'll blend that submalar triangle into the piriform and look a lot more natural. Okay? Switch the sides. Okay. I'm going to do just a teeny bit more. So long term, I want to do a little bit more through here, but I needed to build out that chin. Like, look at the difference in his face from that alone. I mean, that's insane or something. And there's a couple of things you could do for the mid face, which we're going to do in a second. You could do Sculptra, and just build with a little bit of collagen here. The other is you could do more hyperdilate radius. So I'm going to take a little bit of the radius here, this area. We're using cannula. It's gonna feel weird, okay? It's gonna look weird too when you're watching. I'm gonna do this 3 times today, all in one day. It's like it rains of pores. It's very good. Perfect. Hold on. Okay, do a little bit. Lift your chin up and this way. There you go. And the good thing about this is you're safe with the cannula. Again, we're just doing hyperdilute. It's almost like when we used to do our HIV patients years ago in a scaffolding pattern. Hold on. There we go. Okay, now go to the opposite side. Turn it in here. Good. Sorry. One more right here. Turn it this way more. Okay. And again, each one of these insertions makes it turn over. Makes it safer for him. So again, just to get more lifting and just to get more blending, we're using the filler to fill this submalar triangle. And the last part is my fave, which is lips. Now, volume, the amount you need depends upon how low volume you are. In this case, he could do more because of the way his face is shaped through this area, but this looks very natural. So we're gonna start in the lip. Here we go. Little touch, here we go. Perfect, very small, okay guys? Now with him, I wanna get a little elevation of that Cupid's bow. Okay, so you see that elevation. A little bit of a show, because he could actually do that. Afford that with his lip.
Someone wants to know, is it easier or harder to do male lips?
Much harder. Why? Because almost no males have an upper lip. They disappear. So you see we created one right now for him. So there's different ways to do it. Depends on the look you're going for. But with him, I think he could have a little more defined lip. So you see that. And sometimes, you know, you need a little more volume. Sometimes it's less volume, just depends on what you're trying to go for. I want him to look very natural. So, what we're doing is giving him a little lift and definition. So that's good, it's about halfway done. And I'm going to show you guys right here. Okay, a little bit of a lift. We're almost there. He's doing really great. key for guys is, you know, this Russian technique or chemo powder, whatever you want to call it. Perfect. We want to do a little bit of an inversion on most guys. So we're going to try and take the central part of the lip, belly. We're going to bring it forward. We're doing a pillar technique. Okay, there we go. Again, what I love about glabella is right now it looks a little swollen, but it'll take shape. This will mold to his lip. And we also do a little in the chin crease to blend the crease. Okay. And then the final. Perfect. Great. Okay. Now we can show them. Beautiful. It is. Look at that. So now we can show them. It doesn't even look like anything happened. It's crazy. So let's give him. What do you mean? Yeah, there's one at this amount is what I understand. Okay. So now let's show them, you guys. Let's do an Emer review really quick. What? So you're gonna take a quick look. Now a little bit of elevation. It's gonna be a little swollen now. Much more volume here. Much more structured here. Softer through here is a lot deeper, and then a little bit on the lip, just for shaping. The goal would be a little bit more back in here, a little bit more here, long term, so it kind of fills out. But if you do too much, it's gonna take away your structure.
Yeah, okay.
So overall, what do you think? Swollen.
The lip won't be that
Oh, imagine if you punch your arm multiple times a day, the lip is like multiple pokes. It'll go down probably 20-30%. It'll look great. It's just more of the shaping because you don't really have any upper lip shape. So once that goes in, it'll look very natural. But the chin, I want you guys to see here. Okay, look, this is a big difference. If you look at the ratio here now, from the 90-degree angle, take a look. It's perfectly straight. You see, slight eversion, projected, straight, and it matches. So now it's all sculpted. Now if we removed all this, we added more volume, he would lose the structure to his face. So we want to keep him natural. So we're gonna pan so you guys can see that it looks natural and enhanced version of himself. And that's it. It looks great. Okay, so